following program does not necessarily reflect the views, opinions, or policies of the City of Oceanside, its elected officials, KOCT, its board of directors, or staff.
Community Health Matters was made possible by a grant from the TriCity Healthcare District and with additional support from TriCity Medical Center.
Welcome to Community Health Matters. This program is a cooperative production of TriCity Medical Center and KOCT, the North County Channel. I'm your host, Ricardo Berron. Our goal with this program is to inform our viewers about health issues here in North County. Our partners in this new series include North County Health Services and Vista Community Clinic. Every program in this series will be produced in English and Spanish. At the end of today's program, I'll let you know how you can share this program with family and friends, but let's get started on today's Community Health Matters. Today, we'll be talking about pre- and postnatal services and the Midwife program, a partnership between North County Health Services and TriCity Medical Center. And this exciting new Midwife program not only has been beneficial to the mother, the baby, and her partner, but it offers also benefits to her family, our community, and ultimately the nation as well. And I'm proud to report that our North County community is already seeing positive outcomes from this program with results that are better than those experienced on average throughout the nation. We have with us today experts on this subject from TriCity Medical Center, North County Health Services, and Vista Community Clinic. With us now is Mimi Mateo, Clinical Director of Midwifery from North County Health Services. Later on this program, we'll talk with Espi Romero with TriCity Medical Center and Teresa Harverson from Vista Community Clinic about pre- and postnatal services. Welcome, Mimi. What is a Midwife program? Please let us know about it.
Thanks, Ricardo. I'm really glad to be here and to let you know about the Midwife program. So in April 2011, with the support of the administration and the clinical staff here at TriCity, we were able to credential midwives to attend women in labor and birth and postpartum for the first time in the hospital's history.
And how did this partnership with TriCity Medical Center and North County Health Services for this Midwife program started?
Well, North County Health Services has a long history of a really positive relationship with the hospital here. And so we worked with that to bring our pregnant patients in so that women could deliver here with the midwives who had been taking care of them prenatally.
And what services and role does the hospital play in this Midwife program?
It was really critical that the administration of the hospital support our attempt to get clinical privileges here and to encourage the medical staff to be open to the possibility of midwives being here. The hospital was also very generous in helping us create a backup panel of community obstetricians who back the midwifery group while we are here at the hospital if we need their services.
Whom do you serve and where are your offices?
So our offices are throughout North County, from Encinitas all the way north and east to Ramona. We have offices in Oceanside, San Marcos, Encinitas, and Ramona. And we accept a wide variety of insurances, including Medi-Cal, and we have a cash program as well.
What is a program like this of benefit to our North County viewers?
I wish I had some of the families that have come to us for care here, Ricardo, to speak to that question. What we hear from the families we serve is that they really appreciate the individualized attention they get from the midwives, the support and education related to nutrition and exercise, preparation for labor and birth, breastfeeding, postpartum changes that not only the mother, but her whole family are going to go through. Midwives are experts in well woman care, And we're experts in normal pregnancy and birth. We also work with board-certified obstetricians, so if women develop complications in their pregnancy, we're able to practice a collaborative model so that high-risk medical conditions get the attention they need while the woman is still getting the care for her pregnancy and all the changes she's going through as she prepares to welcome a new baby. She gets both of those hand in hand. Makes her feel very safe.
Very, very nice. And from what I understand, you have experienced very positive results from this new program after only 2 years of service. Wow. And can you share some of these results with our viewers, please?
Well, I have to say, just like parents with a new baby being so proud, that's really how I feel about our service here at TriCity. I was at the hospital just yesterday, and I can tell you we're almost at the 1,500 baby mark.
Wow.
That's just 2.5 years. And I can tell you that our primary cesarean section rate runs between 11 and 14%. That's less than half the national average, Ricardo. We have less than a 1% episiotomy rate. Women have access to epidural anesthesia if they want it. But in our service, because of the constant presence and support of the midwife with the woman in labor, only about 30 or 35% of the women who deliver with us choose that anesthesia. That means that they have much fewer complications. And then after the baby's born, we're really thrilled to report that 98% of our moms are successful in breastfeeding. And the reason I picked those statistics out for you, those are the items that when women come looking for someone to take care of them, those are the things they're wondering about. What are my chances of having a cesarean, an episiotomy? What kind of help will I get in labor? Will you help me breastfeed? So those are the things we're really proud of.
Wow, very positive results. Does your midwife program include a great deal of extra item that makes this special or unique?
So one of the things that's interesting, midwifery is known as one of the oldest professions.
Yeah.
I have to be careful when I say that. But what it really means, what studies have shown internationally and nationally, it's a little bit of a travesty. The United States has one of the highest infant and maternal mortality rates in the developed nations of the world. If we look at all the developed nations, in 37 countries, women and babies are safer than they are here in the US. And the reason that happens is that we tend to intervene too often. We bring too many of those whistles and bells to what is essentially a normal, healthy process. So I would say the biggest thing we bring is our presence and our support. And because we're with women in labor, they're able to get up, move around, and we keep them safe.
Who are your midwives?
So there are 10 of us midwives who work in collaboration with 3 obstetricians. Midwives are advanced practice nurses, and the midwives in our group all have master's degrees. One of our midwives even has a PhD, and they've graduated from some of the top schools in the country, Yale, Columbia, Vanderbilt.
Incredibly women, talented and very, very professional, right?
Professional and dedicated, hardworking.
I'll bet. Thank you, Mimi, for being with us.
Thank you so much for giving me the chance.
In this show. No, it was great information, great positive results. Thank you also for your service to our community. Well, we're going to take a short break, and when we come back, we'll meet Espi Romero with North County San Diego Childbirth Center.
Sodas, energy drinks, sport drinks, and other sugary beverages raise blood sugar levels, and just one serving provides several hundred calories. That's why, to help prevent diabetes, the American Diabetes Association recommends limiting the intake of sugar-sweetened beverages.
Dinner makes a difference. Learn more at casafamilyday.org.
Hi, my name is Carol Mathewson. During a triathlon swim, I experienced sudden cardiac arrest and awoke from a coma 3 days later. One person dies every 2 minutes from sudden cardiac arrest. CPR performed by strangers saved my life. Please call your local fire department or the American Heart Association and enroll in a CPR class. You could save the life of a loved one or even a stranger.
Cancer is a big idea for a small child.
She dreams of being a figure skater. We're trying to figure out what to do next.
Each school day, 2 classrooms of children are diagnosed with cancer.
The doctor said there's hope.
I'll be brave, Mommy.
If I could just take her place.
It's okay, Daddy.
Only research cures childhood cancer. Give today. You can help fund this life-saving research to conquer childhood cancer. Visit curesearch.org today.
Welcome back to Community Health Matters. Our guest now is Espi Romero, who's with TriCity Medical Center's Childbirth Services. Thank you for coming, Espi. What are the services that TriCity Medical Center provides before the baby arrives?
Before the baby arrives, we can schedule parents to be for a tour. We have tours 3 times a month. These tours are either in Spanish or English. Sometimes if they can't attend any of those tours, we can also provide them with private tours. What they will learn during the tour is everything that's going to happen from the moment they get to the hospital, during their stay, and before their discharge. This includes registration, includes, we cover what they can bring, includes different things that could happen during their stay. How long the baby could take, in case there's an emergency. We do have 3 ORs in the maternity unit, which, you know, if there's an emergency, we don't have to take the patient from one side all the way to the other side. Everything is located in the unit.
You mentioned emergencies. If in case there's a complication after birth, how is the medical center equipped to deal with a situation like that?
We are equipped with a NICU, which is Neonatal Intensive Care Unit Level 3. We are the highest level here in San Diego, North County, San Diego. We have incorporated, as of December of last year, what we have is a NICView camera. So each baby, their bed has a camera. Each camera has a little code. That code is presented to the parents, and the parents can share that with anybody. Family members are out of state or out of the country. This is really important for them, because we do understand that sometimes if the mom has a C-section, it's really hard for them to go back and forth. So with this camera, they can actually see the baby 24/7 through their iPhones, computers, whatever device they have, and they can also have family members see the baby through, like I said, if they're out of state.
That is incredible. That means with the parents' consent, family out of the country, in Europe, in Asia, can take an eye on the baby, right?
As far as I know, we are the second hospital here in California that has those services, and we are one of the 10 in the nation. So for us, that's really big.
What are the 2 or 3 principal questions expectant mothers ask you?
Some of those questions are, if my baby ends up in the NICU, how many people can go see the baby? Usually it will be just the banded person, which most cases is mom and dad. Some of those other questions will be, how many people can I have in the room? It all depends on what's going on. So labor and delivery, they can have up to 4 visitors once they're moved to postpartum. This is after they have their baby. Okay. It depends. If they're in a private room, they can have up to 4 visitors. If they're in a semi-private room, it's only 2.
And what happens if there's a fifth person? Let's say the mother-in-law wants to be in that room.
They will have to rotate. So we do have policies that we need to follow, and yeah, sometimes we do get those families that are really, really big, and the best way to coordinate with them is rotating them. So if it's a private room, like I said, 4 people can go in, and then they have to rotate. And it's kind of hard, especially when it's really, really big family, but we always try to accommodate everybody.
Any other questions while they're asking?
And some of the other questions will be, what can I bring? You know, especially the new parents, we do recommend them to bring whatever they think is going to make them feel comfortable. We do have parents that bring their own pillows, their own blankets. It looks like they're moving in, but you know, it's just, it all comes down to, we want to make sure that this is their own experience. So make it their own, make it feel like if they're at home, or just make them feel comfortable. Here at TriCity Medical Center, the baby stays with the parents from the moment they're born till they're discharged. The only time that the baby's taken away from the parents is for the hearing test, and that usually takes anywhere between 10 minutes to 45 minutes. When they're doing the test, the baby has to be completely asleep. So every time the baby moves, they have to pause the test. So that's why it could go up to 45 minutes. That's the only time that they will take the baby. But parent, which dad or support person, can go with the baby. Another thing is, what kind of equipment can you provide for me? We do have the birthing balls, we have the bars, and also we have the mirrors. We don't have them in every single room because not everybody wants those items. So upon their request, we can go ahead and bring that with them. One of the things that I always encourage the patients to bring, it will be a birth plan. Because by just following some of those things that they want to do throughout their delivery, it just makes it a lot easier for us to provide whatever they need.
Does people ask you, like, what will my room look like?
Yes, that's one of the biggest questions. We do show them a DVD, and sometimes if we do have a room available, we take them back there and they can see. And it's not so much like what does the room look like, they just want to see if there's enough room for their visitors. Like I said, a lot of times they have really big families and they expect everybody to be there, but it's impossible to just let anybody and everybody in the room. One of the other things is when they come, they always ask, can I bring my other children with me if they have other children? We don't have anybody to take care of those kids, so they do have to make several arrangements, and it's a good idea to schedule a tour ahead of time so they can learn everything that they need to do.
What about us fathers? What's our role in all this process? I mean, we're there looking clueless probably all the time. And
most of the time, when they come into the tour, they're like, oh no, I'm okay, you know, I don't need to know any of these things. But then when they come, when the baby's gonna be born, they're running around like they don't know what to do. So the most important thing that we always tell them is just try to stay relaxed and just help your wife or your support person, just stay relaxed.
I think we need help with that.
Yes, definitely.
So another question would be, how do you guys encourage or create a bond between the new parent and the baby after
the baby?
it's born?
Okay, so we have incorporated a golden hour. This hour is as soon as the baby's born, we put the baby on mom's chest, and that is what we call the golden hour. This is also gonna help the mom if she's planning on breastfeeding. If the mom has a C-section, we can always do bonding time with dad. So that doesn't mean that the baby is going to be going just to the nursery. Dad can actually do bonding time with baby while they're in the nursery.
What other services does TriCity Medical Center provide after now the baby?
We have breastfeeding support groups. So this is not just for people who have, or for moms who have their babies here at TriCity Medical Center. It's open to the public. If they're breastfeeding, they're having any issues or any concerns, they can always come to the support group, which meets every Wednesday from 9:15 till 11, or they can call and schedule a private appointment, which we can see them 4 days a week for up to an hour for free.
There are many options out there. Why would our viewers choose a TriCity Medical Center for a service like that?
I think that because TriCity does offer the NICU, that's one of the biggest thing, because a lot of parents don't know that we have a NICU. You know, if your are going through your pregnancy and everything's okay, you never know what's going to happen at the end. So it's better to be prepared. And like I said, the NICU, it's there to help those parents. So they don't have to be traveling down south or anywhere else. They can stay here and they can see their babies whenever they want.
And there's plenty of your personnel that speak Spanish and English and maybe other languages as well.
We have a interpreter group, so we actually can help anybody that comes in.
Awesome. Thank you very much, SP, for your time. We're going to go to a break. When we come back, we'll talk to Vista Community Clinic's Teresa Hovers to discuss their prenatal program.
To keep your mind energized and healthy, learn a language, take a new route to work, or brush your teeth with your less dominant hand. These are easy ways to help activate your brain's biochemical paths and strengthen brain circuits.
Do you think maybe someday when I grow up, I'll be able to see some real polar bears?
I hope so, honey. I hope so.
Do more than hope. As temperatures continue to rise due to global warming, sea ice that the polar bear relies on is shrinking. This is already having an impact on polar bears and is threatening their very survival. But you can make a difference. Go to defenders.org/global warming to learn more.
Welcome back to Community Health Matters. With us is Vista Community Clinic's Teresa Harbison. Thank you for being here with us, Teresa. Please tell us more about your prenatal program.
So we have a wonderful traditional program for our patients. We've been working with Vista Community Clinic now since 1987, so 26 years. We offer prenatal services at 4 of our sites, so 2 in Vista and 2 in Oceanside. And just like a traditional prenatal program, all of our patients see a prenatal provider throughout their pregnancy, and then all of our patients are delivered by an OBGYN at TriCity Medical Center. Nothing really unique about that. What really makes our program unique, though, for our patients is that they see a health educator, a nutritionist, a social worker, and a childbirth educator at least 3 times throughout their pregnancy.
Wow, that is really unique. Can you tell me more about it?
Absolutely. So all of our patients' visits are private and individualized. So if the patient is seeing the health educator, for example, and she wants to know more about exercise during pregnancy, then that's what the educator talks about. We can roll exercise balls into the room and show her how to exercise properly on the ball. If the patient's seeing the social worker and needs help with housing or food, the social worker can help her with that. Rates of depression do increase during pregnancy, so the social worker obviously can be a great resource for that. Or she can just be somebody that mom can just talk to about a work situation or a minor relationship issue. We have 2 nutritionists, and they can talk to the mom about what to eat, what not to eat, how to properly prepare foods, how to cook chicken and meat and bring them up to the right temperature. They can spend time talking with mom about how to gain weight appropriately in pregnancy and then lose weight as well after the baby's born. Very, very important. And then our childbirth educator as well can spend individualized time with the mom talking about epidurals if that's the mom's goal, talking about natural birth if that's what the mom wants. If the mom is planning to have a C-section, well then the childbirth educator can spend a lot of time with this mom talking about what to expect from that. So it's a phenomenal program.
Now let's talk about money, because at times could be hard. So how can you help, or how do you provide this kind of services for somebody that doesn't have insurance?
Yeah, so for our patients that don't have insurance, we encourage them to go ahead and apply for Medi-Cal. And in a lot of places, what that means is go to the Medi-Cal office. Well, you go to the Medi-Cal office, you're stuck there for hours. You usually have to come back with multiple papers, and then your claim's in processing. Well, what we do is we actually set up webcams with Medi-Cal workers so that if the mom brings in the proper paperwork, she can get approved on the spot via a webcam. So she's not in limbo for 45 to 60 days wondering if her application's been processed. For our moms that don't qualify for Medi-Cal or don't want to apply for it, we also offer a very, very affordable cash program too.
So now the healthy baby arrived. What other services does your organization provide for the newborn and the new mother?
Yeah, absolutely. So we know our patients are going to be very well taken care of at TriCity Medical Center by their fabulous, fabulous staff. Obviously, one of our OBGYNs checks in with a mom throughout her hospital stay, and then one of Vista Community Clinic's pediatricians also checks in with the baby too.
So you have nurse practitioners going into the home?
Absolutely, we do. We found it really makes a big difference to actually see these moms and these new babies in the home environment. The nurse practitioners can help out with our moms that have had a C-section, help with wound care, answer any questions about their health. After a woman gives birth, her body goes through a lot of changes, and there can be a lot of concerns and a lot of stressors those early days. So having somebody who can come into the home and help with that is huge. It's also really, really nice for the babies too. The nurse practitioners can help answer breastfeeding questions, help with issues like sore nipples, and can contact the lactation consultants on the site too if mom needs immediate help with breastfeeding.
And speaking of those changes and issues, what about dental programs?
We do offer a really good dental program for our prenatal patients. Dental care is very, very safe in pregnancy. There's a lot of urban legends out there that say it's not. It is. It's very important that pregnant patients get dental care in pregnancy. X-rays tend to be very safe. Antibiotics are good. They can do almost anything, almost any dental work that needs to happen, even though mom is pregnant.
And what about breastfeeding? It's always in the news.
Yes.
There's do's and don'ts and urban legends that you just mentioned. Do you have lactation consultants on staff?
We do. We just added a brand new lactation consultant, so we now have lactation consultants at all of our sites too, to do education with the moms before they deliver, and then also help with clinical help afterwards too. Our lactation consultants can help the mom with pumping issues. They can weigh the baby, make sure that baby is gaining weight appropriately, can help with issues like sore nipples, thrush, mastitis, plugged milk ducts, all those little problems that can really impact breastfeeding. We all know the breast is best, and we all want breastfeeding to get off to a great start now for our moms.
Well, thank you. That's all the time we got. Teresa Hoverson from Vista Community Clinic.
Thank you.
And thank you for watching Community Health Matters, a new health series by TriCity Medical Center and KOCT, the North County channel. You can watch replays of this program on KOCT in Oceanside on Cox Cable or countywide on AT&T UVerse channel 99. The program is also available as video on demand by going to your KOCT.org website. You can watch on your computer, smartphone, or tablet. I'm your host, Ricardo Berron, and remember, community health matters.
Calcium is the most abundant mineral in the body. Known for strengthening your bones and teeth, it also plays an important role in other bodily functions, such as muscle contraction and hormone release. Make sure to get enough calcium from foods such as dairy products, kale, turnips, and salmon.
Community Health Matters was made possible by a grant from the TriCity Healthcare District and with additional support from TriCity Medical Center.